Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues and PGs, we are discussing chronic hepatitis C, and in today's video we shall discuss the life cycle of hepatitis C virus. In the first video we discussed the structure of hepatitis C virus, and we knew that the hepatitis C virus has got the outer envelope and the inner nucleocapsid, and embedded in the nucleocapsid is the HCV RNA genome. And the HCV RNA genome has single open reading frames, and there are the 5 non-translational terminal and 5 non-translational terminal in the translational, and it was translating for the structural and non-structural proteins. Today we shall discuss when the hepatitis C virus enters the hepatocytes, what's the important steps of the life cycle, because the available drugs, they interfere with these important steps of the life cycle and the way they eradicate the hepatitis C virus. So as I said, we are going to discuss the HCV life cycle in hepatocytes. This is the hepatocyte. This is the cytoplasm of the hepatocytes. We know that the hepatitis C virus, it resides in the cytoplasm as compared to the hepatitis B virus, which traverses the cytoplasm and enters the nucleoplasm and resides over there. The hepatitis C virus, it resides, it proliferates within the cytoplasm of the hepatocytes. So this is the hepatocytes and this is the HCV virion. When the HCV virion enters into the hepatocytes, I'm not discussing the mechanisms of its entry, with the help of these glycoproteins and all those things that enters, but when it enters the cytoplasm of the hepatocytes, first step is it encodes itself. It encodes itself. The genome comes out from the nucleocapsid. So the first step is that of uncoating, and the HCV viral genome, it comes out, and then it translates. And when it translates, the next step is that of replication, and then the particles, they assemble and then they exit from the hepatocytes to infect the surrounding hepatocytes. So these are the important basic steps of the HCV virion life cycle. Then entry into this cytoplasm, then uncoating, then translational, and then the replication, and then the assembly, and then the exit. When we compare this with the genome, we knew that there are 3 important parts which are important for the therapeutic point of view. These are the NS34A, NS5A, and NS5B. The NS34A component, this is important for the translation of the HCV virion. So the first important step of the its proliferation, that is the translation, it is mediated by the NS34A. Then the NS5A, it is responsible for the replication of the virus as well as for the assembly of the virions. So the second and third important steps, this was the first step, but the main steps are these: the translation, replication, and assembly. So the NS5A, this is responsible for the replication of the virus and for the assembly of the virus. And the replication is also mediated by the NS5B. So the virion life cycle, when the hepatitis C virus enters the hepatocytes and it encodes itself, and then when the genome translates itself, so the processes, the translation is because of the NS34A, and the replication is because of the NS5A as well as the NS5B, and the assembly is because of the NS5A. Point is, when the drugs, if they interfere with the NS3/4A activity, they will inhibit the translation of the virus. And those drugs which uh, attack or which act on the NS5A, they will inhibit the replication as well as inhibit the assembly of the viron inside the cytoplasm. And those who site action is on NS5B, they will attack on the they will arrest the replication. So this is important that just like any other RNA the main three steps is the translation, replication, and assembly. Translation is because of the NS3/4A, and drugs affecting or the site of action, which is NS3/4A, they will stop the translation, and the drugs which are site of action is NS5A, they will inhibit the replication as well as the assembly of the viron, and the drugs acting upon the NS5B, they will also inhibit the replication. So these are the three important steps, and these are the three ways how we can inhibit these three processes. This is important when we shall be discussing the different DAs. Their mechanism of action will be this, and when the combination, when we use them in combination, they may then the inhibit one or two or even all the three processes, and by that mechanisms they inhibit the virus and they eradicate the virus. So, dear colleagues, I think I have made the point clear that the NS3, NS4A, and the NS5A and NS5B, these are important because the three main steps, which are the translation, replication, and assembly, they are mediated, they are controlled by these three parts of the hepatitis C virus genome, and the drugs which are affecting these three parts, they interfere with the life cycle through these three mechanisms. In the coming studies video, we shall be discussing the different options and how they interfere and what are the drugs options available in the series. So till then, it's Khuda Hafiz and see you in the next video.